A warm welcome to all our viewers, to our series Natural Medicine. Today we want to introduce you to something completely revolutionary, which I think hardly anyone knows yet, but which I think is also very important because it can quickly reduce really acute pain. It's about the topic of gold implants. And the gentleman who is here today is a doctor. But he is not only a doctor, he is also the president of the Academy for Gold Implants. And I want to talk to him about that. Stay tuned, we'll get started right away. And now I would like to introduce my guest to you. This is Dr. Med Harald Burgard. A very warm welcome, dear Harald.
Hello Alexander, good afternoon.
Gold implants, that's a word, and now I feel like I'm getting a gold joint. But that's not the case, it works completely differently. I've already seen a few pictures. Which people and which viewers absolutely have to stick around now? Who should care about what we're hearing right now?
Anyone who has arthritis that hurts them, in the knee, in the hip, in all joints, in the shoulder. Or people who, for example, have chronic migraines due to cervical spine problems, who have back pain, for example after a herniated disc that doesn't go away. These are people for whom gold implantation can be considered. It's normal when someone has complaints, then they usually go to the orthopedist and then the usual treatments are done. That means you give painkillers, you give injections, you do strength building, you do physiotherapy and so on.
Until the operation, right?
Yes, if none of that helps, then the operation will come at some point. This means that you then make an artificial knee joint, artificial hip joint or stiffen the spine. Or it depends, whatever is there. I am always of the opinion you should try everything to preserve your own organs. Because you always bite better with your own teeth than foreign ones. And every organ you can preserve is worth it. And then at some point I got to know gold implantation, which has been done on animals for decades. This was done on animals in 1975. My wife knew that too. She laughed when I came up with it and said it was ancient history when it comes to animals. She's a veterinarian. Dr. Dirks, he started doing gold implants for hip dysplasia in German Shepherds in the USA in 1975. So he put small pieces of 24 karat gold around the joints and saw the animals that were previously limping starting to run again. And then sometime 10, 15 years later a doctor, Kierkegaard from Denmark, adopted this and was the first person to do this to humans. He has now treated well over 9,000 patients. There has also been research at the University of Aarhus in Denmark and other universities for decades that demonstrated how gold works. And I thought it was a cool way to help people without having to put in an artificial joint or without having to stiffen the spine and still get people pain-free. And I've been doing this for a few years now. And we ask every patient, not just me, but also my colleagues who do this. We ask all patients and can statistically prove exactly how many patients benefit from it. It's a simple thing. For example, if someone comes and has pain in their knee and needs an artificial knee joint, then that can be done, of course. But of course you can also go and say, well, let's try a gold implantation and then place very small pieces of gold, maybe I can show them. These are 2 to 3 millimeters in size. I also brought some here with me. They are usually double packaged, sterile. I just have a box with me for demo purposes. I'll open at the right end here. Maybe I can give that to you.
Yes.
As you can see, this is pure gold. These are 2 or 3 millimeter large cylinders.
I hold it into the camera. Yes, so very, very, very small.
And in a very simple procedure with a needle and with local anesthesia, they are not inserted into the joint, but around the joint capsule. Why? If you have arthrosis that hurts, it doesn't hurt because the ends of the cartilage hurt or the bone hurts. There are no pain fibers, but what hurts is the joint capsule, which is irritated by the arthrosis. And we use needles and local anesthesia to place small gold cylinders around these painful areas. And then a process called dissolocytosis begins. This is what researchers at universities found out, which works relatively easily. In 2002 it was already established that it is not the effect of acupuncture, that you stick a needle into it, but that it is actually the gold. It has been found that the body releases ions from the gold. And then a few years later it becomes increasingly clear how it works. It was discovered that the macrophages, which are tissue cells, release ions from the gold and thereby a gold ion membrane forms around the joint, which means that the cells no longer release inflammatory substances. NFB and other substances. And as a result, the swelling goes down, the inflammation goes down, and with it the pain goes away. This is the effect of gold implantation. You go and put the gold around the joint capsule under local anesthesia with a needle without cutting anything, then wait a few weeks to 3, 4, 5 months. Sometimes it takes a little longer, depending on the person. And once this gold effect has set in sufficiently, it will last for decades. And people are actually either completely pain-free or have massive pain relief.
You have a few more pictures. Can you show me that again?
Yes.
It reminds me a bit of neural therapy, where procaine is injected into the joints, which ultimately reduces this inflammation process.
Exactly. I've been doing it for years. I've done at least 60,000 neural therapy treatments. This is fantastic. However, when I give procaine works for about 20 minutes in the place where I inject it, then I have a local effect and of course also have a somewhat longer effect due to various factors. But I don't have any effect over years. Here I go and, for example, if you take the cervical spine here, you can see these individual joints that correspond to each other. And that's often where the arthrosis is, which then irritates the nerve and causes permanent pain. If I go there and, for example,
just sit there, you can't be seen.
When I do neural therapy now, of course I have to determine the points by hand, just like with neural therapy. I decide where I'm going and then use a thin needle to put these gold pieces in there. And this is what it looks like afterwards. After 2 or 3 days you won't see anything anymore. And people can go home immediately after treatment.
So the lady now had real pain in her cervical vertebra.
Yes, that was a lady who had severe arthrosis of the cervical spine, with frequent headaches. Then you put these gold pieces in over several segments. People don't notice it. You can also do an MRI afterwards without the gold flying in your face because it's not magnetic. You can also walk through the airport security control. You don't notice anything, you are completely unaffected. But the gold releases its effect over a certain period of time and then the effect remains. And that's the cool thing about it. You do one treatment, you don't have to do any further treatment. During neural therapy I do it regularly, I don't know, every 2 weeks, every 6 weeks or whatever.
You're trying to promote the healing process from the inside out.
Yes, of course I can't cure the arthrosis. But I can take away the pain caused by arthrosis. And then the patient can continue to live pain-free. That's the crucial thing. And the arthrosis itself, if you now have knee arthrosis, you can walk on this arthritic knee without any problems if the capsule does not send inflammatory stimuli.
Can I go back to arthrosis? That means the bone plates, the cartilage between them, are gone. It's just plate on plate.
Yes, the cartilage is partially gone. It is rarely completely gone. But if the cartilage is missing, then of course other pressure conditions arise. But that doesn't hurt because the cartilage has no pain fibers and neither does the bone underneath. What hurts is the inflammatory stimulus that triggers on the capsule. So I can't heal the arthrosis with that gold implantation, but I take the pain.
Take the pressure off.
And that's where the complaints stop. And then people can walk again without any symptoms.
So the pressure is reduced.
Well, it's not the pressure. It's simply the inflammatory stimulus. The pain doesn't come from pressure. Of course, there is also pressure because all the muscles around it are tense. The muscle tries to protect the joint by closing. When it comes to the spine, when you notice that you have acute sciatica, everything is hard as a rock. That is the protection. But when the pain is gone, the muscles relax again. And that's how it is here too. Also on the hips. We have seen for years that when I provide patients with gold implants, they are either completely pain-free or have significantly improved pain. What's also interesting is that studies have shown that if I exaggerate, for example, your knee is healthy, but you're doing a huge hike now, and then it hurts the next day, then the body releases more gold from the gold implants that are there. So for 1-2 days, and then the pain goes away and then it goes down again. Studies have also shown that. And that's something that my colleague, who I'll be featuring in one of our shows, can also confirm. And that's something we see again and again, that even with heavy strain, the pain briefly increases again, but then goes away a day or two later.
If I look at it a little bit from a physical perspective, then pain is a lack of electrons. Then I can now say that this gold implant is an electron donor. Because you mentioned the word ions. This means that until these two sides come into balance again, and if inflammation increases here again, it will automatically release again.
We just explain it using the proven inflammatory messengers. There are cytokines that arise with every inflammation, such as NFB, for example. It has been proven that when inflammation in the capsule occurs in the joints due to such a friction stimulus, NFB is formed, and then this subsequently triggers the formation of interleukin 6 and interleukin 1, and so on. So inflammatory substances. This is specifically suppressed by the release of gold ions. We have known gold as an anti-inflammatory for thousands of years. The ancient Egyptians already implanted gold to combat inflammation. We have used gold as sodium thiourate and so on, as gold salts in rheumatism therapy. But of course they have crazy side effects. Pure gold never has that. Fine gold, pure gold does not cause allergies, nor does it cause any side effects. We saw that too.
That's what they always say in the jewelry industry. All allergy sufferers can always wear gold without any problem.
Yes, unless you use an alloy that still has nickel in it or whatever. But pure gold is not allergenic. I've never seen it, and neither have my colleagues.
You have more photos.
Yes, here I am examining a knee joint in the OR before the gold implantation. Here we painted the dots again. What you see there, the white spots, are created when I apply the local anesthesia. That's the only thing the patient notices during the entire operation. That you just do the small stitches for local anesthesia. After that the whole thing is completely painless. And this is what it looks like in the X-ray. So these are not shrapnel from a war veteran, but these little dots, these are the gold implants that lie around the capsule. Here you can see it from the side.
And they now release ions that ultimately reduce this pain.
Exactly, the body releases gold ions, which then lead to the inflammatory process being blocked. And permanently. And they never dissolve. There's so much gold in there, you have to be reborn twice to resolve that.
Well, I find it unbelievable what potential this has. Because I see the statistics from orthopedics, it's exploding. Everyone undergoes surgery incredibly quickly and then has something artificial instead of their own joint.
I brought numbers with me from 2011. They are already 10 or 11 years old. You can see how much we operate in Germany. So in 2011 there were 232,000 hip implantations and 168,000 knee implantations. And 10% of each was a replacement of prostheses. That means that if I do a joint replacement, it won't last forever. It has to be replaced again at some point after 10, 15, 20 years. If you're lucky, it'll last a little longer. But you can't do that 5 times. You can do this once or twice and then it's over. That's why I always try, when young people come, footballers, handball players and so on, with shoulder pain or arthrosis in their joints or knees, to offer them a procedure which initially either avoids the operation or at least delays it for years. Precisely because you can't do it as often as you want.
And how great are the success statistics that you can actually prevent the operation if you work with gold implants?
So our internal statistics, but also those of colleagues, show that around 80% of patients have improvements of between 80 and 100%. We're at about 5-point-something% of patients with no change. But according to what I subsequently examined, these are often people who have chronic inflammation. They come and already have rheumatism or other chronic inflammatory processes, where the immune system is simply busy elsewhere and cannot take care of the gold. I have also seen in some of these patients that if I was able to treat them and stop the chronic inflammation, then the joint also improved. And the rest in between has improvements of somewhere 40, 50, 60%. But even that is still a lot. Because you have to imagine that the people who come to us are usually those who are about to have the operation. They're not the ones who say, my knee hurts, I have a bit of arthrosis, I'm going to Burgard. No, those who come are usually the ones who say, well, the doctor has already said 3 times that I need a new knee joint, but somehow I'm scared or I don't know. I don't want to, I'll try this. So they usually come when things are really advanced.
But let's talk plainly again. Every doctor has to know that with these options you can give a patient incredible added value without medication and without surgery, to possibly prevent the worst from happening, with a probability of an incredible 80%. So everyone needs to know that. Why doesn't anyone know that yet? You're the first to tell me about it.
Why doesn't anyone know this? We simply have conventional medicine that is organized. And in our medicine it's just the case that we work with pills and so on, which is quite okay in the beginning. But when the point comes where the joint is so damaged that you can no longer tolerate the pain, then you just do an operation, and that's a huge industry. If I go and do a new knee joint, then at some point 25,000 euros will be due, and then you'll go into rehab afterwards. It's just a huge system that's well used. If I come with my gold implantation, which costs, I don't know, 2,200 or 2,500 euros, that's peanuts. Nobody has to go to rehab, nobody has to have sick days, people go home after the operation and can go to work the next day. This is not established. What should I say? It's like that.
Yes, I am amazed and always ask myself, how do doctors who are looking for meaningful further training options even come up with the idea that this exists? How do you get into this academy? How can I find out about you except through TV today?
Well, of course Corona meant we really had to hold back because you couldn't do much in the last 2 years, but our goal within the scope of the European Academy with the scientists, also with colleagues, is to present this and to make it more public. But that's just a form of therapy that my colleague Kierkegaard initially did entirely on his own for years. At some point a few colleagues came along. I think there are now only 5 or 6 across Europe who do that. That's not really much. Nevertheless, studies are ongoing at American universities, studies are ongoing at Danish universities, which are constantly being continued and also show what is possible. For example, we now have the option of using very microfine gold, you can't even see it here, it's so thin, you can't even see it, and apply it to small joints. There are fantastic successes that can be proven.
And no disadvantages. So it's always worth a try before you go under the knife.
I have never seen a patient suffer from this in any way. We work in a highly sterile manner, like a major operation. That means I'll do it in the operating room. I don't do it here somewhere in the practice, but in the operating room. So it's highly sterile. What can happen? Look, it's basically like me giving you an injection. I can have an effect through the syringe. That's why I work in a completely sterile manner. I can damage a blood vessel and you'll have a bruise that'll go away after a few days. This has never happened to me, but it can happen. You can hit a nerve. If I hit a nerve with a needle, then it will twitch and maybe be offended for 2 or 3 hours, but I won't destroy it. These are basically the risks that happen. That's it. So this is a minimally invasive procedure, similar to an injection if you will, but which offers the possibility of becoming permanently pain-free. With something you don't even notice. When those things are in there, you don't notice them. You can massage the leg, you can do whatever you want with the leg or with the shoulder or whatever. That doesn't hurt. Look, for example, here I have.
How is the training for the doctors? Is this a big deal, a small deal?
Well, that's like everything. Of course, you have to train people properly and that takes quite a while because you need a lot of experience.
Isn't it working? Now. Exactly. So you have to know exactly where to put the gold. So it's not just somewhere around here it hurts, I put it in there a little bit, right? Do you have to work with X-rays and know exactly where it goes?
It's like everything. When I do therapy, I have to know exactly what I'm doing. And here, of course, I have to know the anatomy. I have to know exactly where I'm going. I have to be experienced. I have done tens of thousands of neural therapy sessions. I know exactly where my needle will land when I go in somewhere. This isn't just a matter of pricking somewhere. You have to know exactly where to go and how I do what I do. And that requires experience, that requires training, it simply requires practice. And you can't teach that to someone in a 2-day course. This is a longer internship where colleagues have to treat a lot of patients until they can really master it.
And how long does this training last now? Is that in your academy?
Yes, I would say it will take a year and a half.
Okay, well then it will only spread very slowly, I have the feeling.
I still haven't gotten to the picture.
Oh well. Okay. Can I take it?
Yes, you try it.
Maybe it's locked on that page. No, okay.
It works. Sometimes it works, sometimes it doesn't.
Yes, you're right, exactly. A pity. Nevertheless, we have now heard how significant it is. What pain? So if fingers, joint pain in the fingers, so as soon as there is real arthrosis, can you inject it? In the knees, in the hips, what else? The back, did you say?
Yes, the shoulders, for example, are very grateful too. There are many people with shoulder pain. I also have a picture of a patient who had 8 shoulder operations and was still in severe pain. And after a gold implantation, the issue was over. Then he came with pain in the thoracic spine, then we treated it and the pain went away after a few weeks. And now 2 months ago he was there and had his knee gilded, because he was in pain too.
Oh, now it's working again.
For example, this is a patient who came with shoulder pain on the left side, condition after 8 operations. The man, you can see, is a big, strong person. He sat in front of me and cried. He was in so much pain. Then we did the gold implantation and a few weeks later the pain was completely gone. Then he came in for his back, was pain-free a few weeks later, and now we recently did the knee joint. And people come from far away for it. For example, this is an ankle joint on the foot. Sometimes you have typical footballers who have destroyed their joints by playing football. And you can then just help people with relatively simple measures.
Well, I actually know gold only in the mouth area. Back in the day, I think from the 1940s to the 1980s, people really liked working with gold, right? And that also promoted this anti-inflammatory process. So was that actually good?
Yes, so of course you always have gold alloy in your mouth. You can't put 24 karat gold in it. Then when you bite a nut, you damage your crown.
Then I have batteries and other materials again.
20 years ago, a lot of palladium was used. Palladium is also toxic. So that's something different. Here we always talk about fine gold. This is completely different. And because I don't have any burden on it, I can take these little pieces of pure gold. It doesn't have to carry anything. A tooth made of 24 karat gold is like jewelry 24 karat gold. It's soft, it bends immediately. That's something different.
I think you've probably heard the sarcastic saying I'll add at the end of this topic 1,000 times. But you're a bit more valuable if you do that.
Yes, I've said a few times that we could add a small window. We'll see if that works first.
Yes, assets of the last resort, emergency fund.
Women then chain their men because they are more valuable. Or vice versa, yes.
Good. I'm really excited and will try to pass this on to my studio guests so that they can deal with it. I didn't know that and I'm actually not surprised. I got it. But what potential this has, this type of therapy that can prevent so much suffering and pain. I mean, even people who have had an operation are not always pain-free, on the contrary. There is a foreign body inside.
You can do this even after surgery. If someone, for example, has an artificial joint and is still in pain, you can go to the painful areas. They usually say, it hurts me there, and here, and there too. You can also put gold there locally again. That also helps people.
We're talking over lunch about whether we should launch a test here right away. I don't know if my mother is suitable, she's in the control room. Then you have to decide. But if she's a candidate, then let's put her on TV, do this, let's turn this studio into an operating room, right? Maybe it would be an incentive too. Or we'll come to you, whatever. And we would see how it develops over 2 or 3 months. And if someone really is suddenly pain-free after 10 years of knee pain, then I don't know what more we can say to our viewers than to give such a wonderful example. Thank you very much for bringing this out into the world, for training people and for introducing this technology. As I said, I will be your best advertising partner from now on. This is so gigantic. Thank you very much, dear Harald. He can only laugh, but it's just a joy when you can help people act on the cause, simply through gold, which releases ions and stops these inflammatory cascades. Even if they break out again, this inflammation stops immediately because there are enough ions to balance it out. For me, it's totally fascinating and nice to know that it exists. Please share this broadcast, spread it to people who really have problems with their walking system, with problems in their shoulders or problems with their fingers and so on. You just have to spread the word, to spread help that really works, without having to have any surgeries or taking painkillers for the rest of your life. With that in mind, all the best, see you next time.